Hey there, I'm Sophia, and I'm going to walk you through how to inject Follistim AQ under the skin or subcutaneously. These instructions are broken up into 7 quick steps, which you can jump to at any time using the chapters below. Let's start by making sure you've got all your supplies ready to go. A Follistim pen at room temp if previously refrigerated, a Follistim AQ cartridge at room temp, a BD microfine pen needle, plus alcohol pads, gauze pad or cotton square, a sharps container, and a clean surface. Now, go ahead and wash your hands really well with soap and water. Your next step is to load the pen with the cartridge. Remove the cap and put it aside. Unscrew the pen body from the cartridge holder and put those aside too. Now, take the Follistim AQ cartridge out of its package and clean the rubber stopper with an alcohol pad. With the metal-rimmed cap going in first, slide the cartridge into its holder. Lower the pen body into the cartridge holder, making sure the black rod is pressed against the cartridge. Then screw the pen body onto the cartridge holder, making sure there's no gap in between. The arrow on the cartridge holder should point to the middle of the yellow mark on the blue pen body. Next, you'll set up the needle. Use an alcohol pad to clean the open end of the cartridge holder. Double check to make sure the AQ cartridge is actually in there. Then, pick up a new BD microfine pen needle and remove the seal. Now, hold the outer needle shield in one hand and the cartridge holder in the other. Push the end of the cartridge holder into the outer needle shield and screw tightly together. Now go ahead and put this aside while you prepare the injection area. There are a few places where you can inject your medication under the skin. In the abdomen, just below or to the side of your belly button, or in the leg, in the upper outer area of your thigh. No matter which area you pick, try to avoid injecting yourself in the same exact spot each time to lower your risk of a skin reaction. And never inject into any area that's tender, red, bruised, or hard. For today, I'll show you how to inject in the abdomen since it's the most common spot. First, use an alcohol wipe to clean the skin about 2 inches around the injection area. Then, give it a couple of seconds to dry while you get your medication ready. Pick up the Follistim pen and remove the outer and inner needle shields. You can toss the inner shield in the sharps container, but keep the outer shield because you'll need that at the end. Just don't touch the needle or let it touch any surface. Now hold the pen with the needle pointing up. Tap the cartridge holder gently with your finger to help air bubbles rise to the top. If you're using an unused cartridge, then dial the dosage knob until you hear one click. With the needle pointing up, push in the injection button. Look for a droplet at the tip of the needle. If you see one, you're ready to dial your dose. If you don't see a droplet, then keep repeating these steps until you do. Seeing the droplet is really important. Otherwise, you may not inject the right amount of medication. If you've already used a Follistim AQ cartridge and you need to give yourself another dose, attach a new BD microfine pen needle and look for a droplet at the tip of the needle. If you see one, you're ready to dial your dose. If you don't see a droplet, then dial the dosage knob until you hear one click. With the needle pointing up, push in the injection button and then look for the droplet. Keep on repeating these steps until you see that droplet. Now you're ready to dial your dose. Follistim AQ cartridge doses vary. They can be 150, 300, 600, or 900 IU. And your dose may increase or decrease throughout treatment, so talk to your healthcare provider if you have questions. For doses of 50 IU up to 450 IU, turn the dosage knob until the correct dosage aligns with the markers on each side of the dosage window. If you dial past the correct number, don't worry, this is easy to fix. Don't try to turn the dosage knob backwards. Instead, continue to turn the knob in the same direction past the 450 IU mark as far as it will go. Then push in the injection button and dial again starting from 0. One note, If your dose is more than the deliverable dose of this pen, or is more than what's left in the cartridge, you'll need to give yourself more than one injection. Just remember that you should only use a needle once, so use a new needle for every injection. You're ready to inject the medication, so let's do it. Hold the Follistim pen in one hand, and with the other hand, pinch a fold of skin around the injection area. Using a quick, dart-like motion, insert the entire needle straight into the skin at a 90-degree angle. Press the injection button all the way in to make sure you give yourself the full dose. Wait 5 seconds and then remove the needle and press down firmly on the injection area with a gauze pad or cotton square. So what if the injection button doesn't push all the way in and the number in the dosage window doesn't read 0? It means there isn't enough medication left in the cartridge to complete your dose. To resolve this, write down the number you see in the dosage window. Then start over with a new Follistim AQ cartridge, a new needle, and a new injection area. And follow all the instructions up to this step. The number you just wrote down is the amount of medicine you'll dial in order to complete your dose. Now, your final step is cleanup. Remember the outer needle shield you held onto? Place it on a flat surface with the wider, opened end pointing up. Without touching the shield, insert the needle, which is still attached to the pen, into the opening of the shield and push down firmly. The outer needle shield should now be attached to the cartridge holder and cover the needle. Grip the shield and use it to unscrew the needle from the cartridge holder. Toss the outer needle shield with the used needle into the sharps container for safe disposal. If there's medication left for more injections, put the pen cap on the pen body and store in a safe place in your fridge. Never store the Follistim pen with a needle attached to it. Also, once opened, a cartridge is good for 28 days. When the Follistim AQ cartridge is empty, go ahead and unscrew the pen body from the cartridge holder. Place the pen body down, remove the empty cartridge from the holder, and toss it into the sharps container. Put the Follistim pen back together without the cartridge and cover with the cap until you're ready for your next injection. And that's it. Thanks so much for watching today. Take care.